Hello, and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which is responsible for the Wisconsin State Health Insurance Assistance Program, otherwise known as SHIP. SHIP is a federal program, which means each state has a SHIP program. The state of Wisconsin has SHIP counselors available in every county to help with your Medicare issues. In Wisconsin, you can find a SHIP counselor in your area by going to your local Aging and Disability Resource Center, or ADRC, or you can call the SHIP helpline. The phone number is here listed below. It is 1-800-242-1060. I work as a SHIP counselor for the state of Wisconsin. So if you are deaf, hard of hearing, or deafblind and live in the state of Wisconsin, you can contact me. My VP number is listed below, and it is 262-347-3045. Otherwise, you can email me as well. My email is jenniferm.kane@dhs.wisconsin.gov and is listed below for you as well. If you're from another state, you can still reach out for a SHIP counselor in your area as well to help you with any of your Medicare issues.
This presentation will discuss Medicare and is divided into 6 parts. This is the last part, so part 6, and we'll discuss help for people with limited income, talk about protecting yourself and preventing fraud, as well as reviewing resources that are available to you. Welcome to part 6 in this series. This section will include information about Medicare programs for people with limited income. We'll talk about tips to help protect yourself and prevent fraud. And it will conclude with a review and a list of available resources. Many people with Medicare face challenges when it comes to paying for healthcare and prescription medications. Many people have to choose between paying for groceries or paying for healthcare or their medication. There are some important Medicare programs that can help you. The following 3 programs may provide assistance to people who have limited income. The first one is a Medicare Savings Program, and that's help from the state for people who have limited income and limited resources. Each state has this program, so it doesn't matter where you live, you have access to it. If you qualify, your Medicare Part B monthly premium will be paid for you. Some people also have their Medicare copays and deductibles paid for as well, and this is based on their income and assets. The second program is Extra Help and is a Medicare program under Social Security and is designed to help people with limited income and limited resources pay their Medicare prescription drug costs. People who qualify will get help paying for their Part D plan's premiums, deductibles, and copays. It is based on their income and assets. They will also have no coverage gap and no late enrollment penalty. The last one is Senior Care, and later we will discuss more about this program. which is another program that can help people with limited income. Again, the level of assistance with this program will depend on a person's annual income.
Each financial assistance program has different eligibility requirements. Click the links or call the numbers provided to learn if you can get help from these programs. If you need help, you can contact a local benefits specialist for one-on-one assistance.
Protect yourself and prevent fraud. Medicare fraud and abuse happens often. But there are a few important things that you can do to prevent it and to protect yourself. The Wisconsin Senior Medicare Patrol suggests several steps to take to protect yourself. The first step is protect yourself and others from Medicare fraud. To do this, do not give out your Medicare number unless it's to your doctor or another Medicare provider. There are certain things you should do to protect yourself. You should treat your Medicare card like a credit card. You should watch out for identity theft. You should be aware that Medicare doesn't call or visit to sell you anything. Be very cautious of any offers for free medical services. Remember, if something sounds too good to be true, it probably is. And do pass it on. Share these do's and don'ts with your friends and your family so that everyone is more aware of what they should and shouldn't do. The second step is to detect Medicare fraud by reviewing your Medicare summary notices. If you sign up for mymedicare.gov, you'll be able to access your personal Medicare information online. You're also encouraged to keep a personal health care journal where you can keep track of your doctor visits and the services you receive. Make sure to take that journal with you to your appointments. That way you can compare your Medicare summary notice with what you have written in your journal to ensure they match. The Medicare summary notice, or the MSN, is sent quarterly or every 3 months to people with Medicare. The letter will look like this image on the slide. Be sure to review it when you receive it. This is not a bill. Make sure you check the name, address, and the Medicare number to ensure it's correct. Make sure you look at the notice to see if you actually received that service, and compare what's listed in the notice with your healthcare journal to ensure they match. Be sure that the claim on the notice is processed and paid for. If a service is listed as denied, call your doctor's office to make sure that the claim was coded properly. If not, the doctor's office can resubmit that claim. If the claim was denied, you do have appeal rights. The deadline to appeal is 120 days. The third step you should take is to report any suspected Medicare fraud or abuse. So if you notice something that doesn't seem right on your bill, the first thing that you want to do is call the doctor or the Medicare provider to discuss your concerns. Be sure to gather all of your documentation, such as your personal healthcare journal, your billing statements, and your Medicare summary notice. If the issue isn't resolved and you're from Wisconsin, contact the Wisconsin Senior Medicare Patrol for free and confidential help. You can reach them by calling 1-888-818-2611. We've covered a lot of information in this 6-part series. So before we end, let's do a quick review of the coverage options you've learned about. Remember, there are 2 ways to get your Medicare coverage. One is through a original Medicare or a Medicare Advantage plan. Original Medicare includes Part A and or Part B, and you can add additional coverage such as a Medigap policy to help fill in the gaps of original Medicare. You can also choose to buy Medicare prescription drug coverage or a Part D plan, or you can choose senior care as well. The other way you can get coverage is through a Medicare Advantage plan, which will cover Part A and Part B services, as well as supplies, and usually includes Part D coverage as well. You may be able to add drug coverage to some types of Advantage plans if it is not already included. Again, remember, another option is senior care. This concludes the Welcome to Medicare series. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, otherwise known as SHIP, a local public service for people with Medicare. If you have questions about Medicare, contact the Wisconsin SHIP today. Or if you're from another state, you can contact a SHIP counselor in your state as well. You do not have to do this alone.